but then we are very deeply engaged with the patients. They visit us once a week. There's a strong follow-up. We have very good teams that help them to follow a certain lifestyle. And I think when they get the results, that is what is really motivating. So when their blood sugar dips, let's say in a matter of 15 days, and they have to reduce their insulin dose, that is something that makes health addictive. They really want to follow it because they couldn't believe that they can actually reduce their drug dosage just by following natural therapies. So that is for diabetes. And then for the high blood pressure patients, they find that their pressures are coming down to normal and they have to stop the drugs which they are taking just by increasing the potassium level of the diet, decreasing the sodium, reducing the non-vegetarian food, reducing the inflammation. There are a lot of ways to do that. And once they do that, they find that the blood pressure is normal, so they don't have to take the medication. So we send them to the physicians and ask them to kind of deal with the new person, the new detoxified individual, and they agree to reduce the medications and so on and so forth. Weight is very motivating. The moment they lose their weight, for the obese individual who normally have metabolic syndrome, and that is the intermediate risk factor to developing cardiovascular disease or type 2 diabetes or cancer or most of these conditions. It is metabolic syndrome. So once they lose the weight, they reverse the metabolic syndrome, and that is the key to correction. That is the key to prevention. In fact, I just want to add about breast cancer or any form of cancer. So there was a research which found out that 95% of all cancers do not happen because of the oncogene. When you do genetics, you figure out that it's only 3 to 5% of the people worldwide who are born with a cancer gene. So why are so many people getting cancer? It is lifestyle related. That's how it is. So when you just bring about a change in lifestyle from a 7-year-old onwards, when you do the test, the genetic test, and you tell them you don't have any of these genes, so why don't you just... So I think that really helps. So constantly engaged with the patient and following it up through and through. I think that's really the key.
Fantastic.